There's a saying that, quote, "We stand on the shoulders of those who have gone before us." Climbing atop those shoulders is one thing. Striving to gain our balance once we have arrived is another. But the perspective we experience from this vantage point encourage us to stand tall and trustingly.
I was excited to hear that U.S. News & World Report ranked us the best regional hospital in the state of Arkansas. Honestly, it just affirmed what I think I already knew in my heart.
There's all sorts of competition in this community to say how good different hospitals are. And what this is an outside group that has come in an unbiased way, looked at our hospital and said, we're superior to anybody else in the state. It's not only Little Rock we're superior to, it's anybody in the state. And that is a great, great distinction to have.
It's an honor that St. Vincent was selected, and especially our Department of Geriatrics is one of the 8 listed in the top specialties in the state of Arkansas.
Lots of healthcare institutions advertise about quality and technology, and how is the consumer to know? Look at the results of the patients who get their care at St. Vincent. They can't get it unless they have good doctors working together with good nurses and great technology. That's what we have, and that's why our results are so good.
We've got the technology, we have the experience, the expertise, and great nursing care. So when you put it all together, it comes out to a great experience for the patients.
I trained at a magnet hospital, but I have to say that the nurses here excelled far beyond what I experienced in my training, and it's been a true pleasure to work with many of them, and they teach me every day too.
If there's any hospital that wants a model of nursing and wants to learn from it, this will be the place to come to.
There's just a spirit here that is unlike anywhere else that I've ever been. And it's an idea of collaboration and working together, I think, for the better of improving our patients' lives.
I'm blessed. St. Vincent has the most incredible staff that I work with. The attitude is incredible. It's obvious that they're dedicated to their job, and I think patients sense that.
Any healthcare institution that has survived 125 years clearly has done some things right. I think the nuns would be astounded.
I think the sisters would be amazed at what progress has been made since they founded this institution. The way this hospital is being led right now by the leaders and administration, it's clear that quality is important. It's clear that the patient is important. It's clear that minimizing suffering is important. I think that they would really be proud of this.
The sisters that started here came with a mission, and we're here because of them. That mission continues today.
Those nuns came here with a spirit of compassion and sacrifice to take care of sick patients. They were here because they thought that we needed a hospital, and they built one, and then they made a great hospital of it. We've got the technology to do it. That's obvious now, but there's also that special feeling of community that I think this hospital has had and embodies to this day. It's just different.
What we have here I think is really good, and we pride ourselves by wanting to be the best in the world, not because we want to boast about it, just because it's good for patients.
Some of the providers of the equipment, the imaging equipment in this suite that we're standing in right now have told us that there's none better in the United States. And this is a source of great pride for us.
When people come into the facilities and see how much St. Vincent's has invested in the renovation, not only the cosmetic appearance on the outside, but really just a friendly staff. Everybody seems to have the same goal in common of trying to get the best care for the patients, and just a warm, friendly environment.
People have the opportunity to walk through the halls of the new Jack Stevens Heart Institute and our new facilities, the new cath labs and EP labs. If they had the opportunity to look inside the hybrid OR and to see what's going on a day-to-day basis, they'd realize that this is much, much more than just a community hospital.
We're the best hospital. We do it the most economic way, and it makes a huge difference now, and it'll certainly make a big difference in the future.
Although the past should be appreciated, I'm not necessarily a person of the past. I learn from the past. But it's always the present that I'm interested in, and even more the future. Because I think the future, to a certain extent, can be formed if one has the courage and the conviction and the willingness to plan for it.